All right, everyone, thank you for joining us in this online webinar, Plan Advisors Hawaii. We hope to deliver more of our education and more of our services online due to our current stay-at-home orders, and for potential future events, getting you folks the information at the comfort of your home, and limiting the amount of exposure that we could potentially have. But we still want to make sure we're there for you and that we're delivering all the value that you expect from your plan advisor. So plan advisors, we believe, if this is the first time you're meeting us, is that each individual who's eligible for Medicare should have access to a qualified Medicare specialist who know the local plans as well as our local kupuna, our local population, and we know the physicians, the hospitals, and all the different types of programs out there throughout Hawaii. And with a local specialist, we can and we will provide a comprehensive plan comparison so that you folks can compare, buy, and enroll in the right health insurance at the right price. And we can do that now. Since all the insurance companies have moved online, we can do that both online, over the phone, and when we do get through this, we'll be able to do it in person. And so, to summarize things, we help local seniors and their loved ones learn more about Medicare and optimize their plan benefits. This is kind of how we are different. We actually help you folks throughout your Medicare journey, and by helping you, we work with your physician, your doctor, and we also help coordinate with your insurance. And this is how we do that. So many times members have issues billing, claims, authorizations, and referrals. Perhaps if you lose your card, and also case management. A lot of times there'd be some coordination that we'd have to call in a social worker or something to help our clients get the best transition or understand what kind of benefits they have. And we do that through education, what kind of benefits your plan has, potentially what kind of plan you might need if you are expecting certain benefits, prescription savings, how you can save money on those costly medications, and to help you folks maintain your well-being. A lot of the plans here locally offer a lot of help, a lot of wellness visit checkups, and also reward cards for you folks to just stay healthy and go to that gym. So make sure that you're knowledgeable about those things. And if you have questions, reach out to one of our advisors or reach out to your specific plan advisor. And we also do help with Medicaid and extra help through Medicare. So if you do think you qualify, reach out to one of our plan advisors and we would be more than happy to help you through that process. So now let's go into the Medicare 101 presentation. All right, welcome everyone to Medicare 101. This webinar is pretty much for anybody who wants to learn more about Medicare. So my name is Matt Ragudo. I am a managing partner at Plan Advisors Hawaii. I've been helping seniors locally in Hawaii for the past 6 years choose a Medicare plan. I'm also a chartered retirement planning consultant and have my certification in long-term care planning. So if you have any questions about retirement planning topics, please be sure to reach out to me. All right, and there's my email address. You can go ahead and reach out to me that way if you want. And let's get on to the presentation. So today what we're going to cover is eligibility, what Medicare is, your Medicare options, Medicare costs, important dates, and more. And by the end of this webinar, we hope that you would have confidence and the knowledge to choose a Medicare plan that's right for you. All right, so Medicare is the US government's largest health insurance program. As of 2018, Medicare is serving more than 59 million people. It's run by the Center for Medicare and Medicaid Services, otherwise referred to as CMS, and is part of the U.S. Department of Health and Human Services. Medicare is actually divided into different parts. Parts A and B is what we refer to, or it's called Original Medicare. Medicare Part C is also known as Medicare Advantage, or the private Medicare plans. And Medicare Part D is prescription drug coverage, also called prescription drug plans. So, Medicare eligibility. At age 65, you may be able to enroll in Medicare Parts A and B even if you still work. You may be eligible for a premium-free Medicare Part A through your spouse, although you still must qualify by age or disability. This means that you may not have to have worked to receive Medicare Part A, but you do need to be either 65 or have a qualifying disability. You may also be eligible for Medicare Parts A and B if you're under 65 and have a disability or end-stage renal disease, ESRD, and that, to be kind of more layman terms, that means that you require dialysis or a kidney transplant. Let's go into a little bit more about Original Medicare. So, Original Medicare is offered by the federal government. It covers much but not all of your care. Generally, there's a deductible and co-insurance. So let's go into Part A. Medicare Part A helps cover hospitalization, skilled nursing facilities, hospice care, and home care. Medicare Part A also has a deductible whenever you utilize services under Parts A, and that deductible for the year 2020 is $1,408. All right, Medicare Part B helps cover doctor's appointments, outpatient care, preventative services, occupational and physical therapies, and home health. And Part B as of 2020 has a deductible of $198 and a 20% coinsurance once you have paid that deductible. Now let's go into Part C. So Medicare Part C and D are offered by private companies. It's also referred to as Medicare Advantage, and it may include extra benefits, including prescription drug coverage. Part D, a Medicare prescription drug plan, is available as a standalone plan. So Part C covers everything that Parts A and B cover, and some plans will include dental, vision, wellness programs, and will also include prescription drugs most times. Make sure you talk to your advisor about that. Now, if you purchase a Part D plan, you can only have either Part C or Part D. So let's go and look at what kind of combinations you can do on the Medicare program. So when you do have Medicare, these are the options that you typically have. Option 1 is with Original Medicare. You have Parts A and Parts B, and this is all available through the federal government. Option 2 is having Original Medicare plus a Medicare Supplement Insurance Plan plus a prescription drug plan. And Option 3 is a Medicare Advantage plan. And Medicare Advantage plans includes Parts A and B. Now, you will still be required to pay your Part B premium in addition to whatever the Medicare Advantage plan premium is, if there is one. These plans most times include additional benefits, stuff like dental, vision, gym memberships, and may include prescription drug coverages. MA plans are available through private companies. Now let's look at some important dates. So important dates for those on Medicare is October 15th through December 7th, and that's what's called the annual election period. And what that allows you to do is you can enroll into a different Medicare Advantage plan and a different prescription drug plan for the next calendar year. Outside of that, there is a special enrollment period, and generally outside of these time periods, you can only make these changes if you have it's called a special enrollment period, and that's if you leave your plan area, you leave your group plan, or you have a change in either extra help or Medicaid. Now let's look at what you need to consider when you make a Medicare plan decision. And our advisor, of course, will help you go through this if you so want our advice. So you need to look at how much things cost. How much will you pay for premiums, deductibles, co-insurance, and co-payments? Are there any additional benefits included in the coverage, just like prescription drug plans? Are the plans in-network providers conveniently located? Now, this is very important so that You can work with your advisor to make sure that all the physicians that you are currently seeing are in the network. Have you needed care in the past few years, and do you anticipate your medical needs will increase or your prescription drug needs will increase? Do you or your doctors have a preferred plan? Meaning, does your healthcare provider or the system that you're a part of require you to join a specific plan to receive care? Now think about your needs. Do you have a chronic condition? Will your healthcare needs grow in the near future? Are your prescription drugs spending predicted to increase over the future? Do you need more coverage than Parts A and B provide? Medicare supplement insurance plans or Medicare Advantage plans may help cover some unexpected healthcare costs. So when should you choose a Medicare Advantage plan instead of staying with original Medicare? Well, first, you have to have both Part A and B. And sometimes you will have to pay an additional monthly premium to get access or to join this Medicare Advantage plan. You remain a Medicare member so long as you keep paying your Part B premium. And along with a Medicare Advantage plan, you may have an opportunity to purchase additional supplemental benefits like dental and vision coverage for an additional premium. Now let's look at the types of Medicare Advantage plans that are available. So the types of Medicare Advantage plans are an HMO or Health Maintenance Organization. In most cases with this type of plan, you will have to rely on your primary care provider to arrange all of your healthcare needs. A preferred provider organization, you can choose any provider that accepts Medicare, but you will have to pay more for those providers that aren't in the preferred providers organization. A private fee-for-service generally has a bit more freedom, but network arrangements may still apply. And the last is a special needs plan, and special need plans are tailored toward those who either have a chronic illness or are also eligible to receive Medicaid. There are also institutional special needs plans available for those in long-term care or skilled nursing facilities, and be sure to speak with your plan advisor to make sure that if you have any of these conditions, that there may be a plan that's specially tailored for you. So what kind of extra benefits are there on this Medicare Advantage? Well, Medicare Advantage plan usually include things like fitness programs, vision and dental coverage, access to mail delivery pharmacy, which is very, very good in these times here where we want to limit our exposure to crowded areas, and you have access to a nurse advice hotline, and that also too is very important. You can call them for more non-emergent things that you are concerned about with your health, and they can help you at home, usually at any time. So what are Medicare supplement insurance plans? So these plans are often referred to as Medigap plans, and they work with original Medicare. So Medicare supplement insurance plans have a unique blend of benefits, and Medicare Advantage or Medicare supplement plans, what they do differently than Medicare Advantage plans is they work on top of original Medicare. So each Medicare supplement plan will cover a certain amount of the coinsurance or deductible for Parts A and Parts B. And if you were interested in these types of plans, please speak to your plan advisor for more details and quotes for Medicare supplement insurance. Medicare Part D. So Medicare Part D is offered by private drug companies that are contracted by the federal government, and they're required by law to offer the basic benefits offered by Medicare. The difference is that each drug plan actually has a different formulary or a different list of covered medications. So you can choose a Part D drug plan in one of two ways. The first way is if you were buying a Medicare supplement plan, then you would need to purchase what's called a standalone prescription drug plan. If you have a Medicare Advantage plan and you need drug coverage, you need to sign up for an MAPD plan, which is a Medicare Advantage plan that includes Part D. Now, if you enroll in a Medicare Advantage plans without prescription drug plans, you cannot sign up for a Medicare prescription drug plan standalone. So be sure to work with an advisor to make sure that you don't do that. All right, so Medicare Part D has what's called the coverage gap, or the donut hole, where you may have to pay a higher percentage of the prescription drug cost. You move in and out of the coverage gap when your total costs reach a specific dollar amount, and these are adjusted annually by CMS. So if you wanted to learn more, and during a one-on-one meeting, our plan advisor can actually go through the donut hole and the coverage gap with you, so that you can be aware of any potential, catastrophic costs that you may have to endure when choosing a plan. So be sure to bring with you your drugs that you take, so that you don't have to be surprised by any of these higher costs. And a few words about costs and choices to decide what's right for you. Medicare Part D, Medicare Advantage, and Medicare Supplement plans have separate premiums from original Medicare, which means that you will need to continue paying whatever your original Medicare Part B premium, and if you do have a Part A premium, even when you join any of the plans, the Part D, Medicare Advantage, or Medicare Supplement insurance. You cannot drop your original Medicare because you have the others. You have to pay for both. If you want more coverage than the original Medicare provides, you can choose Medicare Advantage or prescription drug plan, or a Medicare Supplement insurance plan. You want to select the coverage that works best for you. And really, your cost depends on the coverage you choose. Medicare Advantage cost depends on whether the plan charges a monthly premiums, pays any of your Part B premium, and or includes co-payments, co-insurances, and deductibles. Original Medicare and Medicare Advantage plans cover certain preventative services, and Medicare Advantage plans are required to cover everything that original Medicare does. Well, I hope that answered your questions about Medicare. And if you made it this far, congratulations. You're probably one of the few people who actually watched to the very end. And for that, I'd like to congratulate you and offer you this free Medicare plan consultant. You can go ahead and click the link on the description down below. Just input information. You can find out if you could potentially save more money on your Medicare plan. Mahalo. You have a great day.